Hi, this is Steve with BCX Bootcamp, and I wanted to talk to you about knee pain. A lot of times knee pain just comes from a patella or a kneecap that's not tracking properly. It's not staying in the groove as you run or as you walk. So if you notice that you're having knee pain going up and down stairs, a lot of times it comes from a tight lateral outer thigh, your IT band, tensor fascia lata, and perhaps maybe even a weak medial quadricep, your vastus medialis oblique. So I wanted to show you a quick stretch for the outer thigh and some strengthening for the inner part of that quad. First, let's address the outer part of the thigh, the tightness. That might be pulling your kneecap laterally every time you take a step. You're going to support your weight on the leg that you want to stretch. Cross the other leg over in front and shift your hips laterally. Keep your back fairly straight as we come down. If you're doing the stretch properly, you're going to feel it in the outside portion on the side, almost the hamstring, but not quite, of the back leg that's supporting all your weight. We're going to hold this for about 30 seconds. Again, you should be feeling the stretch almost behind the knee, but on this lateral portion. And roll it up. You're going to hold that for about 30 seconds. Next, I'm going to show you some strengthening for the vastus medialis oblique. All right, so after we've stretched our outer portion of our thigh, let's talk about strengthening the medial portion of our quadricep. That's this inside portion. Sometimes we call it the teardrop, sometimes we call it the vastus medialis, and we're going to be working these oblique fibers. So it's as easy as just extending up against resistance. Now, that's not going to correct the problem as we have it. We need to slightly externally rotate our femurs out. In other words, my toes should slightly be out when I terminally extend. I'm really squeezing this inner portion of my thighs right here. Sit up straight, keep pressing out, make it smooth, and squeeze all the way to terminal extension every time. Toes are slightly pointed out. All right, so there's a little bit of strengthening for the vastus medialis oblique, some stretching for the IT band, and that should help our kneecap to track properly. Now, nothing's going to supersede normal hamstring and quadricep stretching, but if you add these things to your repertoire, I think you can get rid of that knee pain once and for all. All right, remember to ice when you're done, and stay tuned for some more tips.